Hi everybody, we're going to do another video for our injection series. This is a lip injection video. Unfortunately, I don't take any more new patients, but I still make these videos because I like the other physicians and doctors and residents who've been using my videos to train to really be able to fine tune and use these techniques. I use the long needle and I've been using it for years, and it's a beautiful technique because you jab less, you poke less, you hit less. It's much more comfortable, much less bleeding, much less bruising, and patients immediately can go enjoy the results and don't have to hide out for several days. Now, bruising can still happen, swelling can still happen, but it's much less likely. The technique I'm going to demonstrate is with Restylane 1 cc. It's essentially the only FDA-approved filler for the lips. However, Juvederm is perfectly fine for the lips. I don't like other fillers for the lips. They don't really work well, and they're a little bit too risky. You have to fine-tune every injection for each lip. Usually the lips can be asymmetric. You can make them more symmetric. You can make it more balanced, and it has to fit the patient's face, fit their height, fit everything. Some people like fuller lips, some people like more natural lips. Everybody's different. This pair of lips is not going to fit everybody. You just have to use that judgment and discuss it with the patients. So here's our technique. Come on in, you'll be able to see. So I'm going to have you tilt your head up a little bit. This is just with numbing cream. There's been no dental block done, purely numbing cream. I'm going to have you leave your lips open a little bit. The long needle technique using Restylane. Entering at the corner, that's probably the one that they feel the most, and then it's a slow, steady penetration. It's not jabbing and stabbing. This technique pushes blood vessels out of the way. You bleed less, you bruise less, you get great results. Unfortunately, the practice with the injectable patients has grown to the point that I just can't see new patients. But my partner, Dr. Kulak, is an excellent injector. She's a board-certified facial plastic surgeon. She's an expert injector, and she does these as well. And she'd be happy to see you. So I'm going to demonstrate this technique for you. You can see immediately it starts filling up, more balance with the lower lip. There's no bleeding, no bruising. Leave the lips open a little bit again for me. Again, I'm entering. That's the one they feel the most. Then it's slow threading of the needle. You don't really want to let the patient see the needle because it can freak them out a little bit. It's long, and people assume a long needle hurts more, while in fact it actually hurts less because you don't have to inject as many spots. And all I do is this. I'm not sitting there massaging it for half an hour. I'm not traumatizing it. Put your lips together, smile for me, whistle like a blowing whistle. You just want to check symmetry, perfectly symmetric, and that's it. So I'm going to finish up, but that's essentially the technique. And you can see, you can get really nice results. People can go out immediately afterwards and enjoy the lips. Thank you.